Before we get started, this is a case presentation about Owen. I just want to tell you about him. He's a part-time mixed martial arts fighter, just like every other fighter out there, unless they're pro. You know, they work a day job, they go and grapple around at nighttime. So he was 6 months ago. He was grappling around, and he got his head landed on. He was on the side. He got his head landed on. Has some issues with his neck and shoulder here. So 6 months ago, all this happened, and before he came in us, he was still having some issues with his neck, especially when sleeping at night. Just feel like it would tighten up and grab him and almost shoot up to his head. And also he had a decreased shoulder range of motion. So combination of those two is not making him happy. He couldn't function how he wanted to. So this is his case.
Okay, so I'm here to talk about my treatment with Dr. Sebastian. For soft tissue injuries like this, I rarely go to doctors because, you know, if it doesn't turn up on an MRI or an X-ray, they just usually tell you to ice it or put heat packs on it. The first issue is completely gone. I don't have any problems at all rotating my shoulder arm back there. And the second issue is almost completely gone as well after 5 treatments, I think, so far. So they've helped tremendously. I would definitely highly recommend ART.
So this is just a short demo of some of the things we did with Owen. This is active release technique. We were doing of the shoulder and of the neck, a little bit of the mid-back. We had to really get rid of some of that scar tissue that developed from the traumatic nature of his injury. So again, this is just some of the stuff we did with him. There was a little bit more, but active release was really critical in his recovery. Now, I want to point out that at least this type of injury can be fixed with almost any type of manual therapy, some faster than others. My biased opinion is active release technique, or ART, is the best. I do it. I was fixed by an active release provider when I was younger, saved me from having a back surgery. But basically, like I said, it's a buildup of scar tissue surrounding some of the brachial plexus, or any of the nerves, main nerves going down to the arm. So make sure that before you take any extreme measures, if you have this type of injury, you know, go see a massage therapist, go see an active release provider, go see someone that does Graston. You know, it's not going to hurt you as long as they don't dig in there, you know, and they don't know what they're doing. But most providers know what they're doing. So make sure to venture out and try that stuff before you take some extreme measures.